Welcome, everybody, to What's Cooking with Dr. Cook. I am Dr. Allison Koch, and I'm the content manager and editor for Foodguides.com, a place for acid reflux, GERD, IBS, and low FODMAP followers. We will definitely get into everything Foodguides.com during this conversation because we are going to talk about lots of resources and tools to address gut health and health in general. And that's why we have our wonderful guest with us today, Dr. Ashlie Morrissey. And welcome, first of all. I'm so glad you're here. And
Oh,
yes,
visit you this way.
I know, like, so really, we were sitting and we've had so many conversations about having a show like this for years now. Just pretty much talking about how difficult it is to navigate the interwebs and to get a hold of tools, resources, credible information. And we've had our own kind of health issues over the course of our decade plus together being besties that we went ahead and put together a resource list for everybody. So if you look in the fortune cookie, there is a link to a doc that you can access that is on the Food Guide site under our podcast page that has a whole bunch of nutrition, health, lifestyle, mental health, and even tools for accessing medications at your disposal. But we're definitely going to talk all about those types of resources and just kind of kick it off. I mean, what have been some of your top kind of issues you've seen in the clinical practice when you are seeing patients and they're coming in and you're like, man, I wish I would have just something on hand to give them? What are your go-tos?
So I am always, and I know I've said this to you in the past, I am always, I meet, you have to meet people where they are. And so, that can look very different if you're in sort of a rural Western North Carolina setting versus, you know, a suburban big city setting versus, if you're practicing downtown in, LA or New York. I mean, where you're meeting that person, where they're coming from, you have to take that into account. Because I feel very strongly that if I meet with someone and they're sharing with me, the difficulties and symptoms they're experiencing, and I take that down and I maybe run it through my mind as far as a diagnostician sort of, perspective, but I don't take into account where they're coming from. And then I spew out, okay, you likely have XYD, Z diagnosis. So let's give you this treatment because that's what this algorithm that you learn in school teaches you is the proper treatment. But you don't take into account that, maybe their parent was on a medicine similar and they had a bad experience. Or maybe there's a cost that is prohibitive because of cost. Maybe there are fears about side effects with certain medications. There's so much that goes into decision making. And so that's why I've always felt so strongly about just finding where people are coming from and involving them in discussions before I ever say, okay, here's what, I don't ever try to just say, okay, here's what you're going to do, because it's that person's body, it's that person's health, it's that person's life. And I can certainly share my knowledge and I can certainly share my recommendations. And I will always say, this is what I would recommend. But let's talk about what's going to work best for you. And I think the biggest thing, especially over the past 2 years, is, COVID-19 has changed the world for everyone. It's changed the way that everyone accesses health. It's healthcare. It's changed the way we work. It's changed the way we have personal interactions. And so that's where you have to take that into account. And I've seen so, and that's why in that document you mentioned, I did include a lot well, I wouldn't say a lot, but there are several references about mental health because, we've talked and it's been in articles, we've talked before, GI issues, increased risk for depression, anxiety, comorbidities for other mental health issues. But just living in the world that we live in today, I see so many coexisting anxiety and depression and other mental health issues that are just not addressed. And you have to look at your whole person. You can't just take out your intestines and just treat that part of you. That's just not how it works.
Absolutely. I feel like sometimes some of the, I hate to say even ancillary services are kind of left out of the whole healthcare equation because it really is a health related quality of life situation because a lot of the times people know like I have to go to a provider when I'm sick, but there's also nutrition, there's also physical activity, there's also mental health, and all of those things combined sometimes just they get sidelined because it's all fit into just one visit with one doctor. And of course you can speak to this because you've seen all different sides of it because you weren't always just a provider, you were also a nurse for many 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 years, and you've also been a patient. So when people are really struggling, you know the whole referral aspect, how many people are actually being referred to a dietitian, to a mental health provider, if they are dealing with pain, physical therapy, all of that, that could actually help with the health related quality of life as well. So, how do
And
you
that's
feel
where
about
I
that?
think I think that's where the options that are really growing by leaps and bounds for telehealth are great. And that
Yeah.
really, if I say there's any silver lining to the COVID pandemic, is that it really loosened some of the regulations surrounding televisits for
Yeah.
different types of health. And so suddenly you have a lot of options that are not your typical brick and mortar, go in and see someone. And so that has really, because unfortunately, for example, in rural Western North Carolina, if I say I have a patient that needs a psychiatrist, it may be 6 months before they're seen. Whereas I can have them see a psychiatrist and be evaluated sometimes day of or next day if I get them in with a telehealth, provider. And so you open the door for people who need care to receive it when they need it. And because it's daunting. I mean that's just it's no matter if it's a mental health issue, a physical health issue, to say you need a different level of care, but you're not going to be able to see someone to receive that for months. I mean, that is just in and of itself, it's depressing, and it's a very real issue. And then, not to mention we get into cost. I mean, cost is prohibitive when you're talking about multiple visits. And a lot of times when we're talking about mental health, that is something we're talking about sort of repeat visits, especially if you're looking to seek therapy plus medication, which is what I recommend and guidelines recommend. And now there are options that are cost, that I will never say that anything is cheap, because everything, depending on where you're coming from, it may, be a little bit of a pinch, but there are so many options that are available, and more becoming available every day. And even for people who are uninsured, and those have always been people who've been left out, and have been the emergency room sort of catching them as their primary care provider. And emergency rooms, hospitals in general, have been overtaxed during the COVID pandemic. So For example, one of the links that is in the document is to a telehealth provider that has a $10 per month subscription option. And they offer primary care, mental health care. And so for $10 a month, which is for most people, that is an attainable, thing. $10 a month, you can be seen and have your primary health conditions managed. You can also be seen and started on medication for mental health care. My understanding is, I think if you want like a weekly therapy visit, there may be kind of an additional cost there. But then also, we get into, even if you're uninsured, there are more and more options for medications that are available. And that has for so long been something that I am very conscientious when I prescribed with patients, that if it is something I'm not sure is going to be covered by their insurance plan, or if I am seeing an uninsured patient, I go ahead and check. Okay, let's see if I can get kind of ballpark figure of what this is going to cost you, and let's talk about if that is something that you can afford. Because let's not end a visit, and I know it's kind of sticker shock. And for people who've never been prescribed a medication and gone to the pharmacy to pick it up and been told that their medicine is $400, $2,000, I mean, that sounds beyond belief.
Mm-hmm.
But that happens, and it not only happens to uninsured people who have high deductible plans, plan exclusions. They may find they get to a pharmacy and they're told, this medicine is out of your price range. And so now we have options. And I personally, I've used the Mark Cuban's Cost Plus Drug Company. I have found it to be very easy, as far as the patient gets sort of an email to set up an account. Prescribers are able to e-prescribe. So that's, this industry standard. And they're always adding medications. And so for a lot of medicines, I've found that that is actually the cheapest option, and it's shipped directly to the patient, which is for most people a big plus. And then there's always Walmart, for I would say almost 2 decades, has maintained a list of $4 generic medications. And they're always sort of tweaking what's on that list, it seems like. But you can get a month's supply of these medicines on that list for $4, or you can get a 3 month supply for $10. And once again, we get into, what's doable. And so, and these are medicines that sometimes I find maybe plan exclusions for a patient's insurance even. And so we end up saying, okay, you are going to have to go to Walmart and say, do not run this through my insurance. And that gets into, people feel like, well, am I doing something wrong?
Right.
And it should, we could spend a whole other hour talking about insurance reform, but that's a whole other issue. But that's so no, you can go to Walmart and you can pay cash for your medication. It does not have to be run through your insurance. And if if the pharmacist for some reason has an issue, then you can always just have it sent to a different Walmart where they don't have your insurance information. And that's where people feel like, well, am I being dodgy? Am I doing? But it's just it's okay. But yeah, to think that an insurance company may tell a patient this medicine is going to cost them, $40, $50, $60 a month, and it's on a $4 list. I mean, to me, that just is baffling. There's no reasonable explanation for that. So, and of course, most people are familiar with GoodRx. I feel like that's a pretty common kind of name now, that you can actually just compare various pharmacies' cash prices for medicines. But it's very useful because the prices vary significantly from pharmacy to pharmacy. But I think the important thing is that as people have become more and more, I think, stay at home, I have found adopters of technology. And I think people who are not comfortable using, smartphones, computers, doing televisits, that I find more and more people, and not not ageist, but just that, different age brackets that maybe were not early adopters of technology, that they are becoming more comfortable. And some of them prefer that simply because of concerns about their health. They may actually prefer to do televisits, and they are becoming more savvy about, well, can I have this delivered to my home? Is there a website where I can get more information about this? And so it's wonderful when you can refer people and say, well, actually, like Foodguides, there's a whole website that you can find recipes and information and tips and resources for you.
Yeah, I was um I was actually just blown away when I first heard about the concept of food guides, an entire website dedicated to onboarding health professionals, nutrition professionals to drive the content. So, it's credible. It's written by professionals and it's free information. I mean, like what is that? And the mission was so just it just pulled my heartstrings from the very beginning that I don't know, it's just something to be proud of. So, which yeah. Um but yeah, and it is really just striking to me the connection and the amount of people who suffer from GI disorders and acid reflux and GERD, and how much of an impact it has on the daily life and the quality of life, and the lack of like resources that are out there that don't include just that list of like 8 items to avoid. So like, and that's great. Like, okay, you give me 8 things that I need to avoid, but really no other options. Well, that's the whole point of food guides. It's like, let's not make this like an avoidance thing. Let's give you some options. But with that, there also has to be, additional information because there's so much out there. When you come to nutrition, you have to have individualized plans too when you're addressing other chronic issues. So, for everybody who has joined in the fortune cookie, there is a link to a Google Doc on the Food Guide site. And it's 3 pages of resources that Dr. Morrissey and I have put together for you that are nutrition, health, lifestyle, mental health, and medication resources, just approved by the docs for you to check out, including a find a dietitian link. Find a dietitian in your area. There's also a telehealth option for those dietitians. And then there's another link for dietitians who specifically are trained in low FODMAP. So for people who are trying to navigate the low FODMAP diet. So that's also another link in there as well. Yes, very helpful. And they service all different countries. So not just in the US of A, they are everywhere, all over the world. So very helpful. Yeah. Ooh, definitely. So, Dr. Morrissey, when I was looking through some of the links that you put on there, I was very impressed, very, very, very impressed with some of the mental health and other resources that you had in there. Because one of the links was, do I need this medication? And it was the Prescribing site. So tell me a little bit more about that.
So by way of Canada, because I cannot, I don't find a lot of, there's research done in the United States, but there's not a lot of sort of kind of consumer friendly on that side of things about prescribing. So basically, in a nutshell, what that so think of studies have shown that if you're taking, say, 8 medications a day, which is not that beyond the pale. I know it kind of sounds like a lot, but it's not really when you start adding in your PPI and your eight medicines. So because medicines have interactions with each other, and they'll study one medicine with another medicine, but they don't study like all the medicines that you take together. And so polypharmacy is another term for this when you're taking so many different medicines. And the studies have shown that if you're taking 8 or more medicines per day, there's 100% chance that you're having some type of symptom from drug interactions.
Wow.
And so the theory is, but because no study looks at drug interactions from a polypharmacy level, because you would have to have multiple pharmaceutical companies cooperating. It's just not how drug trials are done. And so the theory is if you can decrease your medication burden as much as possible, then it's going to benefit you. And so this is where the de-prescribing thought process comes from. And so this website has some links specifically about a few different types of medications, and particularly about PPIs. But it also talks about some different types of medicines for memory and different things. And so it's basically looking at risk versus benefit, which is always a question that should be asked before starting really any medicine, but especially when continuing on a medicine, risk versus benefit. If you're not receiving a significant benefit from it, why continue it? And so I think it's not a question that prescribers ask often enough. And so I feel that this website I like because it actually has both a patient side and a prescriber side. So if you want to go into the prescriber side, you can. It's just a little more science heavy, but it gives you information and kind of rationale for why this is, a conversation you may want to have with your prescribers. And then it gives you sort of dialogue, because sometimes you get in there, you have the 5 minutes the insurance company allots you with your primary care provider, and you have 5 topics you need to cover. And so you want to make sure you get this said in a way, not, sometimes people feel a little intimidated. So this gives you sort of, here's a place to start from. Here is, the concerns you're having, or I have a question about, do I need to continue this, or, or can I switch to a higher efficacy? Once again, it's always risk versus benefit. So if you're not receiving benefit, should you just switch, do you maybe need a different medication? It's not that you don't need that type of medicine at all, but if you are taking that type of medicine, then maybe you need a higher medicine with a higher effectiveness in that same category. If you're having the risk of taking that medicine, you should be receiving benefit. And so that's the conversation and that you need to be having. And it's one more thing of, we talk about managing health and managing all of this. And it is, when we have chronic health issues, it is a bit of like you're managing your own business inside your body. And so, keeping track of medications, keeping track of symptoms, all of those types of things, it can help you know, well, do I need this? Do I not need it? And that's why I like that website. So I also had another one that was very sort of disease specific, and I almost didn't include it. But I did because Parkinson's disease does affect the gut so much. And so most individuals with Parkinson's disease, they have a really, Parkinson's disease has a profound impact on gut motility, movement of the intestines. And so this will impact nutrition absorption. It will impact absorption of medication, and so, of course, bowel movements, we get into swallowing, just the whole nuts and bolts of it. And so that's where the website that was linked to in this document, it talks about, I get a lot of questions about foods, supplements, things that should be taken or not taken. Are they beneficial, not beneficial with Parkinson's disease? And this was sort of a nice summary article from the American Parkinson's Disease Association about, because as you mentioned with like Foodguides, we want this to be evidence-based information, not well, my Aunt Sally ate rutabagas, 3 times a day,
Right,
and
right.
because good for Aunt Sally, but we want to make sure that this is evidence based information. And so that's one thing, the article says, okay, this is research that's been done, and this is what's been shown to have benefit, not, not shown to be beneficial, or there's just nothing conclusive either way. And oftentimes I tell patients, if it's something that's not going to harm you, if it is eating rutabagas every day, and you're not having any negative effects and you like rutabaga and you think it's helpful, go for it. If there, that's the thing with complementary type things. If it's not harmful, go for it. But sometimes there's just no evidence to back it up. It doesn't mean it's not helping. It's just
Right.
found the proof yet.
Yeah, honestly, that's what one of our contributors just wrote a really good synopsis about apple cider vinegar and acid reflux, because you see that everywhere. And, it's kind of one of those things where people will claim like it 100% cured their acid reflux. And there's no research evidence, scientific evidence to back up that claim at all. However, is it going to actually hurt you if you try it and it helps? No, I mean, it's not going to hurt you at all. But yeah, you know, but is there anything out there that physiologically shows that there's any mechanism behind the actual vinegar doing anything to help that reflux? No, no. But is it going to hurt you if you try it and it helps? No.
That's what I tell my patients with restless leg syndrome who either eat mustard or drink pickle juice. I'm like, there's no research on mustard supplements, supplementing your diet with mustard or pickle juice. So as long as you're not exceeding your sodium, with the pickle juice
Right.
intake, you're not hurting yourself.
Right. Yeah.
So that when I tell people, if you want complementary treatments, as long, but I also always tell people, just because it's natural or complementary, that's why you always have to share everything with your providers. Ginkgo biloba is one that I always tell people. There is actually some research supporting ginkgo biloba and memory retention and things like that. However, it also can increase your risk of intracerebral hemorrhaging. So if you are prone to falls, then I can't recommend that for you. It's not safe. And so that's the thing, is just because it's natural doesn't mean it's safe, even if it is beneficial. And it's always that question of, risk versus benefit. That's what it always comes down to. And so I think the big thing is having that open communication with your providers. And I know that can be so difficult when you're, limited by insurance telling you with a primary care provider you're supposed to have 5 minutes in a room. It's daunting sometimes. I think once again, sometimes that's where I'm, reading reviews of these different telehealth companies. A lot of them, because they are cash pay, they're not limited by those types of, insurance type requirements. So you may find you're getting a better sort of quality interaction, a longer time to talk about your history. I mean, it's just, that's sort of something to take into account. But
Definitely. I actually I think it took me 30 years to find a good primary care physician, and he does take his time. So if he's running behind, I'm okay with it because I know that when I get my time with him, he will listen and he will answer all the questions because he's that good. And when it comes to like when I get the survey, like the automated survey from the office, I make sure to fill it out because I don't want him going anywhere, you know. But, again, 30 years. So, you know, it's
it,
it's
it
it's
is
hard.
unfortunate. Yes, it is very unfortunate. And I have, multiple interesting health issues, and so get to see a lot of different specialists. And unfortunately, it's not always a quality interaction. You don't always feel heard. And, I sometimes wonder if I was not in healthcare, if, what would that look like for me? I mean, because um, I do see a lot of different providers, and sometimes they start talking over me and telling me things, and even when it's things I know are incorrect. For example, I saw someone last week who wanted to do a complete gastroparesis workup on me, which I have no symptoms of, just for the record. Um, but
Hmm.
and I've actually had a gastroparesis workup because of a diabetic medication that I was on that was causing a lot of nausea, vomiting, and so trying to see a provider who's telling me that I have something that I know that I don't have. And then even when I'm explaining to them, I've already had these tests run at great expense to myself, and them essentially saying, well, I want to redo those tests anyway. You definitely don't feel heard when something like that happens. And it's so frustrating. And I do wonder, if you don't have the kind of knowledge and background like I do, what I feel so angry sometimes because I see patients and they'll say, you're the first person that's listened, or you're the first person that I feel like has heard what I'm saying and kind of put these pieces together. But to me, that's just the only thing that makes sense. That's the only way that you can do it. I mean, otherwise, you're just basically taping some diagnoses to a dartboard and throwing a dart with your eyes closed. Um, like I said at the beginning, you have to meet people where they're coming from. I have to know, well, just because someone presents with headaches, well, it's really important that I also know that they, paint cars for a living, because then I need to get into with them, are you wearing the correct kind of respirator? Are you being exposed to any kind of, volatile organic compounds? Do we have to worry about poisoning? I mean, if I don't talk to people and find out where they're coming from, I I may not know, I may completely miss the boat on a diagnosis and treat someone for something that's completely incorrect. So, and then to turn around and I know people experience it because I experience it, not being heard, not being, respected for their experiences. And it's just very frustrating. I think though, for people who are not coming from my background, that's where a lot of those websites that we put in that document can be of benefit, because if you educate yourself, and a lot of these, like the CDC website, the Merck manual
Yeah.
for consumers is a wonderful website as well. Um, and even with the Merck manual, you can also click over into the professional side of things if you are more of a science heavy reader. But these are, once again, we get into, these are evidence based. These are going to give you um, disease states, what are symptoms, how are these diseases and diagnosed, what are common treatments, what, if it's not this, what is called a differential diagnosis. So if, for example, you find out you do not have GERD, for example, what would be something else that might give you that symptom? And then you get into, follow those links. So it's pretty, the Merck manual is very well laid out. The CDC, you can literally go starting at A through Z and read about every disease state I think
Yeah.
that exists. But that's the thing. You want to dedicate a rainy Saturday to that. But I think that's the thing. If you have something going on, no, educating yourself, then you are able to go in and when a provider says, well, I think blah, 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 then you can, and print out the pages. I mean, take notes with you. I always encourage people, to take notes with them to their doctor's appointments, take notes during the visit, that because, I always feel like, my patients leave and have a question. And I always say, please get in touch with me with whatever pops in your head when you get in the car or get home or tomorrow. Please, because I'm not, the one thing I'm definitely not is psychic, or I would have the lottery numbers already. And Allie, who would
Oh,
be.
yes.
But if we had, if you're coming in and you've, maybe pre kind of educated yourself a little bit and you've printed out some information that you want to make sure you cover, because like I said, if you're getting 5 to 10 minutes with a provider, make sure you've highlighted, okay, I want to make sure I mention this, and then you have your pen handy to write down, okay, this is what they said. Ask them for a copy of your visit note. It's yours. You have a right to it. And then you can make sure you understood everything you discussed, because there's going to be a part in it called your assessment and plan, where they lay out step by step everything that they're planning as far as your treatment, and other things as far as if they think there's a differential diagnosis, like if they're unsure about the diagnosis. And so you can have a copy of that. But then also, if you have questions, always, ask. There really are no stupid questions. So there's some that come really close. I'm going to be honest. There's I've been asked. I had to go. Did you mean that the way you? Okay, but that was okay. So, just for the record, we cannot perform brain transplants. Just to clear, if anyone else just just can't do it. Not in the science yet. So, um, but no, I think information, education, being informed about what's going on with your own body, that is so important. And it makes you, if you were gonna, like I said, you're in the business of managing your own health. No one else, unfortunately, is really doing it. You get to see your provider for a few minutes every few months and do this, rapid check in. And so you kind of want to make sure you're covering everything that needs to be covered during that time.
Well, definitely. Well, I would like to open up the stage if we have anybody in the audience. Thank you all for being here today. If you have any questions for us or any comments, we would love to hear them. And while you're thinking about it, what would be your top tips then, Dr. Morrissey? Top questions maybe for somebody who's headed into their doctor's appointment?
So I would say if it's a GI complaint, and say we're going into your primary care provider, that's typically where you're going to start. So the first thing I would say is have your symptoms kind of down, because the first thing they're going to ask you is, what are you experiencing symptom wise? How long has it been going on? How does it affect your, life? Like, is it severe, minimally? How's it affecting your quality of life? So have that answer in your head, because it can be really frustrating when you're trying to nail something down and someone says, how long has it been going on? And you go, a while. And so
Yes.
about think about that before you get in there. Really, sit down and, before you get in there and say, well, it was Jimmy's birthday and we had the steak. And then I know, that was the first time I really noticed these symptoms. So that you have kind of a better answer than, oh, it's been a bit. And then, my next question is going to be, well, how long is that? Oh, wow. Well, and I'm still going, I don't know if this is an acute episode or if this is a chronic episode. I'm still kind of going, okay. So kind of have your information before you get into questions. You want to make sure your information is spot on so that when they ask you those questions, you can say, it started, March 15th. The first time was after I had, a martini with dinner and a steak. And that night I couldn't sleep and I thought I was having a heart attack. And, then they're going to say, have you done anything for it? So if you've taken medicine, have a list of any medicines or over-the-counter remedies. If you've been drinking the apple cider vinegar, if you've been taking over-the-counter Pepto, anything, you want to make sure you include all that. Over-the-counter stuff also, you want to make sure that's included. And then they're going to say, did that help? Or they should ask you if that helped. And so think back about, well, when I took the apple cider vinegar, it helped usually 4 hours, but I still woke up in the middle of the night, or it didn't help at all, whatever the answer, is. So then they're going to get all their information. They're going to mash around on your stomach. Should listen to it first, kind of check you out. And so then they're going to talk to you about, treatment options. And usually they're going to talk about a proton inhibitor, a PPI. So a lot of these are over the counter now. So a lot of times the thing that I tell people is make sure that your insurance covers it if they prescribe it, because some insurances, because they're over the counter, they are available over the counter, they'll say that you have to use the over-the-counter option. So you want to make sure they're prescribing it at a prescription strength so the insurance will cover it. If you're uninsured, then find out where the least expensive option is. And then if you have questions, because, for example, some people are concerned because there have been studies showing a possible link between memory issues and PPI. And so if you want to get into that, that's something you can actually read more about in some of the links we shared on the document. Now, if you want to ask more about that, you may want to ask, okay, is this going to be a short trial of this medication to see if it's helpful? Or are you planning on leaving me on this medication for a long term? Is this going to be a chronic medicine? And so that sometimes is a question to ask. And then another question, anytime you're starting any treatment plan, is you should ask if this doesn't work, let me back up. You should ask, side effects, any possible side effects. And don't get into the crazy list you get from the pharmacy. Okay. Don't
what they read on the commercials when you're watching TV, everything possibly bad and you'll die when people are hopping through the woods. Yeah.
So we're not looking for panic attack. We're looking at what is the thing people complain about most often.
Okay.
For example, if I start people on ADHD, medicine, I go ahead and tell them you're going to have a dry mouth. You're probably going to have a headache for 2 weeks, and everybody wears an Apple smartwatch, and you're going to see your heart rate go up, because those are the things that I get phone calls about the most. They're not the things I really worry about as far as side effects the most, but they're the things that people are most aware of because they're bothersome. That's the kind of thing what should I be aware of? And then the other thing, anytime you're starting on a treatment plan, I think you should always ask, if this doesn't work, if this isn't helpful, if this does not control my symptoms, if this does not improve my quality of life, what's the next step? What's your plan? Because your provider should always be it's like chess. I'm not playing checkers with your health. I'm playing chess. If this treatment plan does not work, then I already have at least a few moves of what we're going to do ahead of this. And so you should always, say, okay, if this does, and also how long are we going to give this? Is this a medicine I'm going to be on 2 weeks or 4 weeks or 8 weeks before we know if it's helpful? And so you have a reason, you have a realistic expectation of what's going on there. And that's the thing. So, if they say, okay, we're going to start this medicine, you can expect these side effects. We're going to give it 6 weeks. And then I want you to let me know if it's not working. If it's not helping you at 6 weeks, then I'm going to increase the dosage and we'll try it for another 4 weeks. And if it's not helpful at that time, then I'm going to change you to another medication and we're going to get an upper GI. Just for example, just throwing
Right,
some stuff out.
right.
But to be a plan, and so that's those are reasonable questions to have.
Absolutely. And it's so nice to hear that from a provider, like, yeah, you would actually accept those list of questions and you encourage them because people do need to advocate for their health, 100% and come into their visits prepared because I know that one of the things that I think is frustrating about going to see a provider is the pain scale because a lot of the times you're asked, what is your level of pain right now? And then that's not addressed again. So that would be, one of my suggestions would be to write down what's your level of chronic pain, but not maybe right then you're having a great day, So having notes is a great thing.
Yes, yes. And that's where I think I always am in favor of whatever makes life simpler. And that's where we didn't get into in our document, but there are so many applications because most people have their phones with them
Yep.
all the time. Hopefully, you're giving yourself a break before bedtime, but I'm going to let that go right now. But there are so many free applications that can allow you to track, and even if it's just the note section, or I forget what it's called on an Android phone, but they have a similar, whatever. But just, I had, you know, had some issues with this symptom and, the date, and, had a lot of pain on my, left side of my chest on this, just kind of so that you can at a glance, look back over and quickly see what's been going on. How often are these symptoms happening? Is there a trigger? I mean, that is oftentimes a huge thing that we're looking for. Is there a trigger for different things? And so, as tedious as it can be, keeping track of symptoms is the best way to identify triggers. And so anything that makes that simpler. There are specific apps for specific disease states. For example, Migraine Buddy is a free app that makes it super simple because it's literally a touch screen of, okay, I'm having a migraine. It's this bad. It started at this time. I was at this place, and you go through and it's just touch, and you've logged it, and so different disease states have different applications like that make it very simple. Now, when you're dealing with kind of multiple symptoms, sometimes it's just easier to find a general kind of health tracker. And so that can even, I think, MyFitnessPal, which is free, has a notes
It does.
option.
Yes. Yep.
And so I have some patients that use that because you can also track like blood pressure, weight. And so that allows you to keep track of a lot of different metrics within one application that way. But it's ultimately whatever is going to work best for you. And that's, once again, we get back to, meeting you where you are. If you are, a good texter and you can tap and type out a little note really quickly, great. If you are better at tap a touch screen, find an app that lets you just log it in 5 seconds using a touch screen. But the thing is, finding something that works for you.
Yeah, if anybody in the audience has a suggestion for any helpful health apps, please let us know. I know that Dr. Morrissey and I both enjoy our Finch app for mental health. So it's free. It's called Finch, and it is honestly the cutest thing ever. It's where you grow these birds and they go on adventures and they after they come back from their adventures, they ask you questions and determine more about your personality, but
They
you can
force
tell
you
us more about it.
they're secretly forcing you to journal is
It
and
does.
they're secretly forcing you to do mindfulness exercises. And it actually within the app has actually validated assessment tools like the GAD-7, the General Anxiety Disorder 7. Sorry, I have to like go into my certain part of my brain. And then it has the let's see. I think it's the PHQ-9, which is like a depression assessment. It has the body. Oh, you probably know that one better than I do, but your perception of your
Yes,
body.
yeah, it's the body image awareness.
Yeah,
Yeah.
yeah. So it actually has these validated
Hmm.
tools that you can administer through the app. It's really, I have to say, I think it's a really nice mental health tool. So,
Oh yeah, breathing exercises, all sorts of really cool stuff.
oh yes,
Yeah.
yes.
Nature
It's
sounds.
I have been recommending it to patients right and left. Just it's like as the and by the way, you need the Finch app.
Yeah.
Like everyone just Finch app. So yes, I think it's wonderful. I think everyone should get it.
Yeah.
So
And you can earn rainbow stones to dress your finch. So I
yes,
think mine has like wings and a little like, baton, sparkle baton right now. It's super cute. Oh,
wonderful
yeah, and some
hat I
sunglasses.
mine has on bunny slippers and like a pink robe and a choker and like
Anything to help though. And it you can set goals. And if you've had like a really rough week, your goals can be very simple, like just washing your face and getting out of bed. So and just even meeting simple goals just makes you feel better. So mhm.
I highly recommend.
Yep, definitely. Well, this has been very, very cool and very informative. And, thank you everybody for showing up. And again, check out our resources. The link is in the fortune cookie. And yeah, we just appreciate you all. And definitely check out foodguides.com, of course. New stuff all the time. And next week we will be cooking some no bake granola bars. So dairy free, um, and gluten free. So that should be fun, but they taste awesome and they're no bake. So I won't have any lids blowing off the stove. So it should be good. Definitely. But thank you so much, Dr. Morrissey. That was really, really cool to have you just talk
A pleasure
about.
as always.
Yay.
Bye, dear.
Awesome. Well, bye.
Bye, everyone.
Thank you all. Have a great night.